Hello, everyone. Welcome to the Preemie Health Talks. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, as you know, as CPBF, and your host for this event. The Preemie Health Talks is the first of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. Next month, we will have the Preemie Power Week, and all the information is already available on our website. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANS, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and education Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With the Preemie Health Talks and Preemie Power Week, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world, which are extremely valuable to help us care for families and their babies. And I want to thank AbbVie for the unrestricted educational grant and all our volunteers and amazing team who worked really hard to organize this event. And today we have two talks, one with Marianne Bracht, who you can see on the screen, and Dr. Michael Narvi following her presentation. And right now we're going to talk about common inter-illnesses, decreasing the risk. Coughs and colds affect us all. But for babies born preterm, it can be more serious. Why are preterm infants at a greater risk, and how can we decrease this risk? And how can we support families to feel less anxious, not only take their baby home from the NICU, but also in the first couple of years? And to answer those questions, I have here with me Marianne Bracht, who for 43 years of nursing experience in neonatology, as a bedside nurse in the neonatal follow-up clinic. And she was also the NICU parental resource nurse and the RSV nurse coordinator in the NICU at Mount Sinai Hospital in Toronto, where I had the pleasure to be on her care 8 years ago with my son, Gabriel. Marianne also participated in international research on family integrated care, and her experience has given her insight into struggles parents encounter in the NICU, as well as following discharge. She's now retired-ish, but she's still fully engaged in research, and she's an active member of CPBF. Marianne, thank you so much for joining us here today.
Okay. Thank you, Fabiana, for that introduction. And hey, folks, I'm not that old, I promise you. Anyway, I'm going to talk about, as Fabiana said, I'm not going to waste a lot of time. She's already identified what I'm going to focus on today. Okay, so there are many consequences of prematurity, and we all know many of them, but I'm only going to focus on two. One being the interrupted lung development, which results in immature airways. And depending on the amount of respiratory support that infants receive, they could end up with a diagnosis of chronic lung or bronchopulmonary dysplasia. Bring your attention to Dr. Theo Moraes, who at Sick Kids Hospital is going to talk tomorrow and more about BPD, COVID-19, and the immature lungs and what they know so far. The other area that I'm going to address is the chronic lung, the immune system. So here's a slide on normal lung development. To our right here, we have our term lungs, complete airways, all those little air sacs that you can see, the little white fluffy things. And what are air sacs for some of the moms and dads and other people that are watching? These are the little alveoli, little sacs at the end of these airways. So you can see these airways, and this is where the exchange of gases take place. Okay, so we breathe in, goes all the way down the airways to these little air sacs, out around the body and back up through these airways and out into the atmosphere. So it's extremely important for breathing. So the full-term baby, when they're born, they are capable of functioning at birth. On the other hand, when we look at this slide here, the preterm lungs, infants less than 36 weeks gestation down to 24 have very, very immature air sacs, if at all, when they're that early birth. And so that does cause a little bit of problem. Okay, so the other area is the immune system, and this is the maternal transfer of antibodies. That happens in a full pregnancy, the last trimester, okay? So anything prior to that, there's a whole lot less antibody transfer, and then these babies don't get the full protection that they should. So what I have done here is I've actually circled in this graph the bar that identifies the level of antibody transfer to the full-term baby. And you can see how high that is in compared to the bar next door. And this one here is the antibody transfer between infants less than 36 weeks gestation down to 32, and that's less than half. And then the bar next door is that 28 down up to 31 weeks gestation, a little bit above that half of the other group. And then we go down all the way down to the babies here born less than 28 weeks gestation. So these babies are at high risk at birth, high risk in the NICU, and they also are somewhat at high risk when they go home, and I'm going to talk about that as well. So Canadian Premature Baby Foundation have an infographic, and this is extremely important information for parents and healthcare professionals. You can download it and read it. It says the same thing that I've talked about in terms of the immature lung development, the full-term young development, and on the other side, we have a pregnant mother, weeks gestation, and the transfer of antibodies. So what does all this mean when the baby is born and goes home? Okay, so we have the protective antibody level with the full-term baby, and I have identified that with the green dotted line here up at the top. So this is the full-term baby, and down at the bottom, we have the months of age, okay? So this full-term baby goes home and the maternal antibody levels are up here. And the preterm babies, when they're born, they're all the way down here. So when they go home, you can see that they're even at higher risk, okay? So what happens in the first 6 months or so, these antibodies are absorbed, maternal antibodies are absorbed as the babies start to make their own. The less than 35 week infant falls somewhere in between here as well. So they also dip similarly to everybody else. Now, for the preterm infants, the antibody level should be similar to a full-term baby around 10 to 12 months of age. But for the infant that was born very premature, that could easily take longer. Okay, so what does all this mean in relationship to respiratory infections? Now, I do believe there are other people from other countries other than Canada listening in, but these are the Canadian positive respiratory viruses. And I have here Canada 2019 to 2020. And I do believe that the reason why they measure it from September to September is so that we can have a good idea of what the winter months look like. So these bars depict different viruses. The most common cold virus, just the general little thing, is Rhinovirus, and that is shown here in the brown bar. The RSV virus, which is the one we worry about the most, is also there. It just peaks just slightly above those little brown bars, so you can see it there. But look what happens as we move into December, January, February, and March. It is the most common cold virus and the one we worry about the most. Down here at the bottom, I'm showing you the viruses that they've reported so far between 2020 and 2021. You can see it's the rhinovirus, so the cold virus, but a little bit of yellow is peaking just above those brown bars. So what does all this mean when it comes to decreased immunity, immature lungs, in combination with an RSV cold or an RSV virus? It is the leading cause of severe lower respiratory tract infection, bronchiolitis, and pneumonia in Canada and worldwide. The result can be hospitalization, possibly lifelong complications, and in some cases, death. That's how serious it can be. Those at higher risk are less than 3 months old, and I'm going to say corrected age. So the full-term baby would be 3 months old. The preterm baby, you would have to consider that from the day they should have been born. I want to draw your attention to infants that are less than 36 completed weeks gestational age. A lot of those babies are born and go into the postpartum floor. They don't go to an NICU or a level 2, yet they have immature lungs and an immature immune system. They could weigh 5.5, 6 pounds. They could only be in hospital 3-4 days. And this baby is at risk, but may be considered with family members as being full term. I mentioned bronchopulmonary dysplasia, and also other infants are significant congenital heart disease. Newsflash, Dr. Bosco Pace will be talking on Wednesday of this week, 12 o'clock, the burden of RSV in healthy preterm infants. So, as Fabiana said, I was around for an awfully long time as a nurse and in the RSV program at Mount Sinai Hospital. And what I learned over the years, it's all about education. It's education for staff in the NICU. What's the burden of disease? I had no clue when I was a bedside nurse that RSV was the most significant. It's all about educating the community, the clinics, RSV clinics, public health nurses, pediatricians, doctors' offices. But the most important thing is year-round parent education. Think about a 35-weeker that is born in September, weighs 5.5 and 6 pounds, goes home. When you saw my graph of the immune levels or the immature lungs, that baby is at high risk in November, December, January, February. The premature baby, 24 weeks, born in July. So year-round parent education. And this was all addressed in a survey that I'm going to talk about on Wednesday. We asked parents what their needs were and their knowledge. And I'm going to share with you that there have been gaps between staff, NICUs, community, as well as parent education throughout the year. What do parents want to know? Well, I'm sure for the moms and dads that are listening today, you want to know, is your baby at risk? And why is your baby at risk? And I do believe it's important for parents to understand why, not to frighten them, but to share why and things to do to decrease the possibility of their babies getting sick. What should they look out for? Is there a medication? When should they call the doctor? What should they do? Because they're super anxious when they take babies home that have been in the NICU. We've all seen this. We've all seen coughing and sneezing, but we've learned so much more, the community has, regarding virus transmission. COVID-19 has hit us in the face. But look at that dirty hand, full of bacteria and viruses. We can't see it, so we really truly don't understand that when we're constantly touching our faces, that this is a problem. The other issue is that viruses can remain on hard surfaces for many, many hours, and information is changing daily, especially around COVID-19. What I can tell you is how long RSV survives on objects. The red line here, the solid line, hard surfaces, cell phones, books, tabletops. The blue, paper tissue. You blow your nose, you throw it in the garbage can, you wash your hands. Skin. RSV sits on hands for half an hour. Gloves, 2 hours. And that's actually become my big bugbear, because we've been putting gloves on since COVID-19 appeared. A lot of the people out in the community. But guess what? It becomes dirty hands very, very quickly. And they think their hands are clean. And what do? They touch their faces. So it's extremely important to share with families and all of us to remember that our hands have to stay away from our faces. Parents often ask me, flu, do I need to worry about flu? What about my baby? What kind of virus is out there? When does this happen? Is it the same as RSV? How is it spread? This is extremely important information for families and for all of us to be able to share it with them. Decrease the risk. Flu shot. Flu shot for everybody except for babies under 6 months of age from their birth. Okay, so who or which babies are at great risk. And these are infants less than 4 months of age, corrected age. So remember I said to you, the immune system is at its lowest peak between 4 and 6 months of age. So we have to be really careful when we're correcting our baby's age to remember that they still are at risk. Any difficulty breathing, lots of vomiting, not feeding, or if parents are worried, parents, please, if you are ever worried about your baby, it's so important to call your doctor, go to the hospital, or call 911. I know going to the hospital nowadays, people are frightened because they're scared of what viruses may be in the emergency department. So it's important to decide doctor, 911, but you've got to call if there are any issues around breathing. When I say around breathing, I mean a change in your baby's breathing, okay, a significant change. Some of us have had flu, headaches, muscle, body aches, but you know, babies can't tell us this. So it's really important to observe babies and be very responsible and call your doctor if you're worried. There are more than 200 different viruses. Rhinovirus is one of the most common, and you saw that in the brown bars. The most concerning one is RSV. The general symptoms, a cold. We hate colds. We got runny noses, blocked nose, coughing, sneezing, general irritability. A note to everybody, infants are nose breathers until about 6 months of age. So it's not possible for them to feed well, breastfeed, bottle feed, if they can't breathe. So we have to also worry about dehydration and babies not getting enough fluid. RSV behaves like a cold. Maybe a runny nose, maybe a possible fever. If the baby's smiling at you and feeding, maybe it's RSV, maybe it's not RSV. But what we worry about, and I've talked about this, is something called bronchitis and pneumonia. I would like you to look just here at the corner where I have a little diagram of an airway. Okay, so the airway to the left, I guess, is clear or patent. There's no infection there. But what happens with RSV is the lining of the airway becomes swollen, okay, inflamed, and then we have infection there. And you can see that this airway is all blocked up. What happens when that happens, especially in a really young baby, they can stop breathing. Apnea, to those of us that know the word. So congestion in small airways is very worrying. It will cause wheezing and sometimes very difficult breathing. It is a 911 call if you see a baby that's having difficulty, blue lips, fingernails, or any form of dehydration. We don't want our babies to get bronchitis or pneumonia. So, what do all cold viruses have in common? And they do. Cannot treat them with antibiotics. No over-the-counter medications for infants and young children under the age of 6 years. So no cough and cold medications, nothing there that you can see on a shelf in a drugstore. Please speak to your doctor before you buy anything or you want to give anything to your young children and babies. No vaccines for any cold viruses, there's only the flu shot. As mentioned, call the doctor or 911 call if you're worried. Here is a downloadable common winter illness booklet that's on the Canadian Premature Baby Foundation website. It's also on Prema Quebec website. Talks a lot more about colds, coughs, bronchitis, influenza, RSV, etc. A very, very important resource for families. Please refer them to it because they can share this with family and friends as well. A brief message about RSV prophylaxis, RSVP to some of us, Synagis or palivizumab to others. This is an injection. It's not an immunization or flu shot. It's an antibody, so it's passive protection. But each province have different guidelines, and different parts of the world, different countries have different guidelines as to which infants qualify for this particular injection. So it's extremely important that now that I've mentioned it, and for parents online that you're listening to me and you've never heard of this, but you wonder if your babies qualify or might qualify or did qualify, please, for Canada, consult your provincial health website or the infant's doctor And the Canadian Premature Baby Foundation has a website that links directly to the Canadian guidelines. The injection will not prevent the baby from getting an RSV injection. The purpose of it is to try and keep the baby out of hospital. It's important to follow the hygiene protocols, everything that COVID-19 is coming out with today. That is the most important part. But for those at extremely high risk, so extremely preterm infants, they benefit from having this protective injection. So how many doses do you get? Well, it's given in the winter. It's given in the baby's first winter, and it depends on when the baby was born, and it depends on when the baby goes home. It's important to follow the schedule, because if you don't, this injection protects month by month, hence the monthly doses. Please ask questions and follow the guidelines. So vaccinations, extremely important. Amount of dead or weakened virus. It helps the immune system to protect against certain diseases. And for the healthcare professionals, I think it's really, really important that we talk about vaccinations with families, because it's important that they know the importance of it. They need to know that it's safe and effective at keeping the baby from being sick. The one thing that's really important, premature babies should get their first three, the 2, 4, and 6 month vaccination given from the age of birth, so their chronological age, not corrected age. Okay, so where I take you back to that chart with the decreased immune and the immune protection, you see how important it is for these babies to receive the vaccination from the date they should have been born. It is important to keep the schedule. We do not want chickenpox outbreak, we don't want whooping cough outbreak, and we don't want flu, and we don't COVID all together. Remember, the flu shot for everybody, but the baby has to be older than 6 months of age. Okay, here goes with herd immunity. Extremely important. I have a little diagram here of a lot of little yellow people. And all those people have been protected, but there were 6 that were not, okay? And a virus came along, be it chickenpox or whatever happened. And you can see over here that those that have been protected continue to be protected, although 1 or 2 that weren't are now going to be infected. So herd immunity refers to the immunity or the protection of the population against a specific disease. The amount of people that are needed to receive the vaccinations to ensure a herd immunity differs for every virus. Vaccines protect you, and then you protect everybody else. And that's where we go with the flu shot. The flu injection, if I have the flu injection, I'm going to protect you. So it's extremely important for our families to understand how important vaccinations are. We all know about hand washing, but the 2 things that I want to bring to your attention here is, if you have water, then we want you to wash your hands with soap and water first. If you don't have soap and water available, then use hand sanitizer. It needs to have at least 60% alcohol. And remember, please keep your hands away from your eyes, your nose, and your face to try and decrease the risk. Okay, so I'm going to talk about face masks, and this has actually become my big bugbearer, because people are wearing face masks, as we know, on the streets, in stores, or whatever. But you know, they're not worn properly in many cases. They're either on the top of their forehead, they're underneath their nose, their mouth, around their necks. It's not protecting them, and it's not protecting me. Masks should be washed daily. We need to handle them by the ear loops. Take them off around our ears, bend them over in the middle so we don't spread the virus, and then we need to wash that mask. We need to wash our hands before we put our mask on. We need to wash our hands when we take our mask off. Please do not touch your mask with your hands, because the previous slides I showed you a dirty hand. We don't want that on the mask either. I can't tell you how many people I'm seeing going down the street with hands on their faces and their masks. I want to sort of say to them, in fact, yeah, I don't want to tell you what I want to say to them. Anyway, masks have become a big issue for me. Okay, so now I've shared very, very quickly lots and lots of information about what we need to share with families. And now we have to take into consideration how uncertain families are, how fearful they are, and how do we support that? Well, we need to ensure appropriate referrals to the clinics that they need to go to, public health nurses, that they get the support they need. And the other thing is we need to be able to provide the tools to educate, so they can educate family and friends. So for example, that common winter illness booklet, because that has the information, they can share that with families, and then they don't have to spend a lot of time trying to prove why everybody can't visit or needs to wash their hands. We frequently underestimate what parent informational needs are, and I think that that's important. I learned that over the years. But the education and the information has to align with the infant's medical condition and their social circumstances. For example, if it's a 35-week infant that's going home and they don't have any siblings in the home, then it's a conversation about decreasing the general risk. If it's a 24-weeker going home that's been on a ventilator for months and they have siblings in the house and daycare, that changes the education and the information. So I'm going to talk on Wednesday about the survey that was done this year through the Canadian Premature Baby Foundation, parents telling us what their knowledge was and their informational needs are, and they've come up with some amazing suggestions to try and decrease the concern that will help them go forward when they take their babies home. Okay, so now going home. Well, that is tough, as I've mentioned. How do parents balance winter illnesses, COVID-19, family, and baby? So what parents have told me over the years is it's really, really important to encourage families to share their story about their experience in the NICU. Today, parents are not able to go into the NICU, grandparents can't go into the NICU, family and friends can't go into the NICU, so they don't really know what parents have gone through. The Canadian Premature Baby Foundation has a letter for parents to adapt and share with family and friends. We also got to remember postpartum depression is higher in moms as well as dads who have had a baby in the NICU. Now, taking a baby home, it's cold, it's dark, it's winter, and let's add COVID to the mix. It's tough. The other thing is parental guilt, and these are the things over the years that they have told me. What about their nieces and nephews or friends' children that aren't vaccinated? It's a big issue, and that has increased. If a premature baby gets whooping cough, they're going to be extremely ill. So it's really, really important for parents to be honest and share with them their fears, because there are celebrations, there are special holidays, Halloween, birthdays. I know it's decreased now during COVID-19, but it's still happening. Parents used to talk to me a lot about traveling, but again, that's decreased at the moment. The other thing is, family members would say, well, you know what? How is your baby going to build up their immune system if they're not exposed? Well, you know what? I agree, but not in that first year. Let that baby build up their own immune system, improve their lung growth, and be stronger so that they can fight off infections. What about if someone's sick at home? What am I going to do? Kids in daycare, kids in kindergarten. Well, no kissing. We see a lot of kissing. Kissing of feet's probably okay. Designate an alternative person if mom's sick. Keep surface clean. Lots of wiping more down, and increase the hand washing. So what are the key messages during COVID-19? You know what? These were the key messages last year, and they were the key messages for the 20 years that I worked in the RSV program. Follow COVID recommendations. I love them because they're out all the time and everybody's hearing them. So everybody is really getting a clear picture about how to decrease the risk of infection. Hand washing, masks, and avoid sick people and crowds. But you know, go for walks, parents. You can go out there, you can walk, but be safe about it because you've got to get out in the winter months. It's a long 4 or 5 months. Keep your baby's vaccination up to date, but also keep your children, if you have other children in the home, up to date. Everybody get a flu shot. And if your baby is receiving RSV prophylaxis, keep to the schedule. Those injections are important. They need to be monthly to be able to protect the baby appropriately. If you're having a challenge or you're worried about this, speak to the RSV clinic, the doctor's office, and also take care of yourself, even if it means sitting in a chair for 5 minutes and taking a deep breath. Okay, so there's a stack of resources out there. Caring for kids, information for parents. These are, Canadian ones. I also want to bring you attention to the RSV booklet here, and that's available on the rsvshield.ca Canada. And that is a fabulous booklet that every parent should have. By the way, even full-term babies, this should be in the postpartum floors as well. It should be everywhere because every baby, we don't want young babies to get sick in the winter months. We want to keep them all out of hospital. So if parents have a general idea of RSV and hand washing, etc., let's keep these babies out. The Canadian Premature Babies Foundation has a stack of information, common winter booklet, the infographic. Please have a look at it. Please download it. And Prema Quebec, that is the parent foundation in Quebec, have a lot of information in French. Public Health Agency of Canada, you can download this to find out what's happening with the RSV. They had that beautiful graph that I downloaded it onto this presentation. Immunize Canada, fabulous handout here for parents and the importance of immunizations, and of course, kids' health, which is extremely important. So I've literally run through this. In days gone by, Fabiana, I used to spend lots of time chatting with families. So I'm sorry if I've rushed through this, but if anybody has any questions, please.
Thank you, Marianne. We do have some questions here. Thank you so much for presenting this information. You can stop sharing your screen now. Marianne, the amazing information, and it's so necessary for families. I had a son who was a term baby, and I had a preterm baby after, and I had never heard of RSV before. And I think this is so important to really point it out that information is important for families, because of you, I learned about RSV when I was at Mount Sinai with my son. You taught me how to do CPR on my son, which ended up saving his life just 2 months after we were discharged. So I think that information is very important. I'm looking forward to a presentation on Wednesday to talk to healthcare professionals how to educate families on all those topics. So we have a few questions coming from our live. One of them is how long, you touched a little bit on that already, but how long the previous immune system will stay behind?
How long do babies stay behind from the immune system?
Yes.
Okay, so on the data that's available is that they feel that the preterm infant catches up to their full-term counterpart by about 10 to 12 months of age. But the earlier the premature baby, the longer that might take. So essentially, I'm going to say to you, the first year corrected age, okay, I'm actually going to go corrected age for the premature population. The babies are at risk, extreme risk. I'm also going to say all children under the age of 2 years also are at risk, but the premature baby, I think we always used to say, and this is one of the things that I was really happy about in Canada, because we went to 1 year maternity leave for mothers, because we really wanted to keep children, premature population, out of daycares.
So Marianne, the next question is, about going to doctor's office for RSV injections or other vaccinations during the pandemic. There was a lot of anxiety on families of actually leaving the house, but how important it is for families to actually go to those appointments, keep these appointments, and are the doctor's office a safe place to go?
Well, pre-COVID, yes, you have to go for your immunizations, because if your baby comes in contact with whooping cough or chickenpox or something like that, it's extremely worrisome. And especially if you have children that are also going to school, those children need their vaccinations up to date. I used to say to parents pre-COVID that, well, first of all, I'm going to suggest you speak to your doctor. Most doctors are making parents wait in the car, or most doctors are making parents wait in different rooms. So please speak to your doctor to find out what their protocol is for your baby to get their vaccinations, what the protocol is in the RSV clinic or doctor's offices for the RSV injections, and go. And if you're early for your appointment, do not go into the doctor's office until you're ready to go. Now, I know some people may go on the public transit, so that is a little bit more of a challenge. You may want to check to see if there's anywhere in the building that you can wait, but I want you to speak to your doctor, because they're the ones that want you to keep your baby safe.
Absolutely. Another question, does isolation affect the development of antibodies in a baby born prematurely? For example, with this pandemic, babies aren't exposed to others as much. Will that ultimately affect their development of antibodies?
No.
No.
No. And antibodies, all babies get maternal antibodies through the placenta. Full term get their full complement, and premature do not get their full complement. These antibodies get absorbed as the babies start to make their own antibodies. The babies are going to be making their own antibodies. So that is a natural thing that's going to be happening. So yes, it's going to happen. So I don't want you taking your babies out so they get exposed to whooping cough or COVID-19 or any other viruses. And this week, Bosco Pace is going to talk about RSV and the premature baby. So I think he can address that a little more. Tomorrow, Dr. Moraes from Sick Kids is going to be talking about BPD and how that, and the immune system, how that works as well. So I think I'm going to leave it at that, because I do believe that it's a fine line. Premature babies, we don't want them to get sick. We want them to build up their antibodies in the normal way that babies build up their antibodies.
Okay, one more question coming from Julia. I imagine your career, you have come across parents who are opposed to the vaccines. How do you address their concerns?
In my 20 years of working in the RSV program, I rarely came across families who refused the vaccine. They were more worried about nieces and nephews that had refused the vaccine. My experience is that parents were so anxious about their babies and understood the impact of whooping cough and those kinds of things on their babies that they you know what, I have to say that was never a big deal from the parent perspective. Yes, they needed maybe a little more conversation. Yes, maybe they needed to go and look it up. Yes, maybe they needed to talk to their other child's pediatrician. They did research, did whatever they did, but I do not remember baby not getting one.
Okay. Marianne, now families are taking babies home in a very different circumstance with COVID-19. Many symptoms are similar to the flu. What can families do if a parent or a caregiver is suspected to be positive for COVID-19 or they're waiting for the results?
They need to be isolated from everybody in the home. So the baby, any siblings, partners, grandmas, anybody there, they need to isolate themselves. They need to call their doctor. They need to call the baby's doctor, because it could be a baby you're talking about. It could be an 8-month-old. It could be an 18-month-old premature baby, or a baby that has some medical complications. Call your doctor, talk about the issue, what you're concerned about, isolate, and then wait to see what the next step should be in terms of your baby. And I believe that actually I would ask people to ask Dr. Morey tomorrow, because he's going to talk about COVID-19 and what they know so far about the premature lung.
Absolutely. It's going to be a great conversation. Marianne, about the RSV booklets, can people order on RSV Shield website? Do you know where? I know I had one that I kept and I still have it from my memorabilia from the NICU.
But you know what? Thank goodness I had one here too that I took a picture of that I was able to put on the presentation. You can download it. So not the booklet per se, but you can download the information. And what I forgot to tell you was it comes in a lot of different languages. So it's incredibly important. Healthcare professionals, if you're listening, I don't care where you are in the whole world, there's about 8 or 10 different languages. Download it, have it available in your NICUs. Postpartum floor, please, any postpartum nurses, any moms or dads who are pregnant and going to have a baby, a full-term baby, please, 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 it's important to know about RSV.
Yeah, and I think you can send a message on the RSV Shield website to see if they can be delivered to your hospital or to your unit. Marianne, let's talk about anxiety, because parents do feel anxious taking their baby home in a regular circumstance. I guess I feel that COVID-19 is putting a lot of more pressure and an extra layer of stress for parents going home at this time, especially if they're bringing babies home on oxygen. We know the challenges of it. So what can you tell parents to cope with their anxiety during this time? We talk about educating parents and how parents become more empowered and more knowledgeable when they are educated, but how else can they cope with their anxiety, with the stress of this time?
Well, it's tough. Okay, I'm going to say it's tough for parents because they're anxious. What they've seen their baby go through, what they've seen other babies go through, it is so, so tough. I'm going to suggest that parents have told me over time, sit down, breathe through your nose, try and relax, and understand that you know your baby's the best and you are doing the best for your babies. Yes, your baby may get a cold, but you know what your baby's breathing is like. You know how much your baby's feeding. You have the power and you have the knowledge. And I think that's why parents need to know how to decrease the risk, but to know not to blame themselves. And I think this is incredibly important. Children get sick. By the way, my son got RSV and I'm a nurse and I couldn't believe it. Got RSV. How did you get RSV? I wash my hands all the time. I guess I did not. And yes, I did blame myself. So you know what, I can't take that anxiety away from you, but what I can say is that you need to take a deep breath. If there's a partner in the home, go for a walk around the block. Take your baby out for a walk around the block. The actual air outside is not going to make your baby sick. Okay, it's viruses. So go for a walk around the block, sing, dance, jump up and down. Fabiana, what did you do?
I thought you were going to ask me because I did bring my baby home in October, beginning of RSV season. He was on oxygen and I made sure I kept all my appointments for the RSV injections. And I did have a son who was 3 years old in daycare. And I was very, very anxious. And I shut down my doors. Nobody came to my house. We didn't go anywhere besides appointments. 6 months later, I was very sad and very anxious that I had not left the house. It was very hard for me. So when I talk to parents today, I do recommend, yes, do go for a walk. And do, you know, now with COVID, we can't do much, but you can still go for a walk. You can still take your partner, get some help from your partner, or maybe your mother-in-law, or maybe some close relative that is in your bubble to go maybe to a grocery store. My outing, it was going to a grocery store 6 months later, but I highly recommend get out of the house for a little bit, just to, as you say, to breathe, to take a break and to ground yourself again, to be able to parent that child that you've been through so much. but it's time, you gotta take some time for you, because, you know, as cliche as it sounds, you gotta put your oxygen mask first, and then you can take care of the rest of the family.
Yes.
It's challenging, it's absolutely challenging. I've been there, I can totally relate to the parents. I cannot even imagine in times of COVID-19 what it is. But Marianne, you have one more question here, which I think also Dr. Michael Knight will be able to comment on that, because it's going to be talk about protocols on breastfeeding in times of the pandemic. He says breastfeeding babies can't be isolated from their mothers. Do you suggest a mask for illness instead?
You know, what a great question. Thank you for that question. That's really, really important. Mothers cannot. So if you, first of all, continue breastfeeding, that's extremely important, because you're passing your antibodies through the breast milk to your baby. That's really, really important. So keep that going. Hand washing, hand washing, hand washing. I would suggest, if you have a partner, somebody in the home, that they change the baby's diaper, they do the basic care for the baby, and they hand the baby to you. If you, wearing a mask is fair enough, but keep your hands away from that mask. And remember, after about 20 minutes or half an hour, that mask gets damp and it can become dirty Kleenex. So if possible, put your baby down in their crib if you're alone. Go get rid of the mask properly, round your earlobes off into the garbage can, and wash your hands. Okay, so keep breastfeeding. Bottom line, hand wash, no kissing, kiss the feet. Oh, actually, don't even kiss the feet, because if your baby's putting their feet into their mouth, no, you're going to have to get better first.
Okay, Marianne, thank you so much for joining us here today. You always have amazing information. I'm so grateful to you. As you know, our story goes back 8 years, and I'm truly grateful for you to continue to share your knowledge and your expertise with our families and healthcare professionals. And I'm looking forward to seeing you again on Wednesday to talk about the survey that we had done with parents earlier this year to understand their knowledge of common inter-illnesses and RSV. Marianne, thank you.
I have one thing to say. Please, please, please enjoy your babies when you go home, because they are so much fun. Premature babies have the best ever personalities. Babies who've been in the NICU have the best personalities. Enjoy them. That time is short, because Fabiana, you really, you know, you had a lot of fun with Gabrielle, and it's really important. So anyway, good luck, hand washing, have fun, stay safe. Thank you.
Thank you, Marianne. And thank you all of you for joining us. Thank you all for joining us here today. And I really want to thank AbbVie again for the ongoing support with the unrestricted educational grant to make this week possible for us. And just for all of you to know, CPBF is a registered charity, and 100% of all donations received during this week, we go to our educational programs for families. To donate, please go to CanadianPremies.org. It takes only 3 minutes of your time, but will have a big impact on the families that we serve.